When we think about a fire drill, the whole point is that you plan the escape route while the building is, well, perfectly safe.
Right, exactly. You walk through it, learn the exits, and just hope you never actually need it.
Yeah, because trying to figure out the safest path while the alarms are blaring and smoke is filling the hallway, I mean, that is when chaos takes over.
Oh, absolutely. Panic sets in immediately.
Exactly. So today's deep dive is really about preventing that chaos, but for your health. We are looking at a highly critical legal and medical document from our sources out of Mexico as of March 2026. It is called the Voluntad Anticipada, or the Advance Directive.
Such an important document.
It really is. Okay, let's unpack this. Our mission today is to figure out how this tool guarantees a dignified end-of-life experience.
And why it is absolutely essential for protecting your autonomy.
Right. We want to give you the clarity you need to navigate this, frankly, really heavy topic.
It is heavy, yeah. And to really understand the mechanism of this document, we have to look at the legal line it draws. Because you likely already know the fundamental difference between active euthanasia and simply, letting nature take its course.
Right, because in Mexico, active euthanasia remains strictly prohibited.
Exactly. What the voluntad anticipada actually regulates is orthoeuthanasia. So that is allowing a natural, dignified death by rejecting treatments that just artificially prolong life.
Right. The medical term in the sources is obstination therapeutica, which is therapeutic obstinacy. Basically, when a patient is subjected to aggressive treatments that won't actually cure them.
Yeah, they just draw out the suffering.
So what does this all mean then? I mean, if it's not active intervention, isn't it just giving up on the patient?
Well, what's fascinating here is that it actually represents a massive pivot toward proactive palliative care. The General Health Law, specifically Article 166 bis, gives doctors the legal framework to stop those aggressive treatments.
Oh, so they can switch entirely to pain control and emotional accompaniment.
Exactly. And Mexico City actually laid the groundwork for this at the state level, way back in 2008.
Wow, so it isn't just about giving up or walking away. It's actually creating a legal shield. Like the doctors need to know they won't be prosecuted or sued for stopping a ventilator.
Right, or refusing to do another surgery. That legal shield is the entire point. It lets medical staff intensely manage a patient's comfort without constantly looking over their shoulder.
Fearing a lawsuit from a distraught family member who just isn't ready to let go, which is totally understandable.
It is understandable, but yeah, it protects against that.
But to give doctors that kind of ironclad shield, I imagine the bureaucracy in Mexico has to be pretty strict. I mean, you can't just write these wishes on a napkin and expect a hospital to honor it.
Oh, definitely not. The sources outline two very distinct formal paths. The first is the preventative modality.
Which is done while you are healthy, right?
Yes. You go to a notary, and you are required to appoint a representative, a substitute, and you have to sign before two witnesses.
That sounds like it costs money.
It does, though campaigns like March, Advanced Directive Month, offer pretty significant discounts.
Okay, so a notary, multiple witnesses, a designated substitute. That sounds like a lot of red tape. But I guess it makes sense if you think of that appointed representative as your healthcare bodyguard.
Oh, I like that. Healthcare bodyguard.
Yeah, you're legally hiring them to stand at your hospital door.
And we should be really clear about who that bodyguard is fighting off. They are holding the line against a hospital administrator terrified of liability, or maybe a well-meaning relative who flies in the last minute demanding one more experimental procedure.
Because that representative doesn't make new, agonizing choices for you?
Exactly. Their only job is to defend the document you already signed when you can no longer speak.
Okay, but what if you never ran that fire drill? Say you're already in the hospital and you've just been given a terminal diagnosis. You don't exactly have time to call a notary.
Right. In that case, the system shifts to the health institution format. And this one is completely free in both public and private hospitals.
Oh, wow. So you just do it there?
Yeah, you sign it right there before medical personnel and two witnesses. However, the mechanism changes a bit because it absolutely requires a formal medical summary validating the terminal state.
Ah, I see. Because without the notary proving you made this choice clearly in advance, the hospital needs undeniable clinical proof that therapeutic obstinacy is actually occurring.
Right, before they change the care plan. It establishes the clinical context required to protect everyone involved.
That makes perfect sense.
And regardless of which path you take, you can also specify your wishes regarding organ donation. Plus, the entire document is 100% revocable at any time.
Wait, really? Anytime?
Yes, you simply express a change of mind using the same formalities.
Well, ultimately, this tool grants you personal autonomy and it guarantees you receive palliative care instead of pointless procedures.
And it gives your family peace by removing the burden of those impossible choices.
It really does. But it brings us right back to our opening thought. A fire drill you planned 20 years ago might not help if the building has been completely remodeled.
Because medical technology advances and, well, your own physical condition changes.
Exactly. Which leaves us with a final thought for you to consider today. Since you can revoke or update this document at any moment, how often should you actively reevaluate and discuss your end-of-life boundaries as medical capabilities and your own personal values inevitably evolve?